Good afternoon, everyone. Thanks so much for, I don't even need, oh no, we need this for the recording, never mind. Good afternoon, everyone. Really excited to have you all here. As you can see from the slides, and yes, and from the attendance sheet, you guys understand that this is about K Awards. I have an amazing panel of K awardees, some of them that I'm meeting in person the first time, which is really exciting. And so we're hoping to give you a little bit of a snapshot to each of our experiences, and then go into a little bit of some of the challenges that are unique to K awardees in emergency medicine. I think last time we did this, a lot of you guys are already in the process of applying for a K or have some experiences already, and you're here, I'm sure, with some specific questions or have your own experiences in applying for a K as well. So we're hoping to make this as interactive as possible. And so if you guys at any point have any questions, please interrupt, ask us questions, because the point of this is to make sure that you guys all get your Ks. And so if there's anything for us to do to help you get there, please let us know. So I think we start out with sort of our own personal journey slides, which is going to be really fun to hear all of you guys do that as well. So before we start, we wanted to just poll the audience. Is anyone thinking about applying a K, like a pre-applying K process? Cool.
Excellent.
How about you're definitely going to write a K, but haven't maybe necessarily started yet, but have started looking for mentors and started planning? Cool. All right. How about you all in already the writing, submitting process? All right, guys. And then have been scored or not scored and have to rewrite or resubmit. All right. This is great. Actually, kind of a nice mix, I think. Yeah. So obviously, when we talk about the writing of the K and the process of resubmitting, all of you that have done that experience already, please speak up and share your experiences as well. Because I think Elizabeth had told me this, we each have our own unique experience in situations that are very different, which is what's exciting about emergency medicine, but also challenging. So the more that we can crowdsource that experience, I think the more successful we can be as K awardees. Cool. So I know we started with Michelle.
You can skip over.
Oh, okay, cool, we'll come back. She has amazing graphics. She needs to teach me how to do graphics.
Yeah, you can see.
You know?
All right.
Alrighty.
So this is mine, and I actually think this is more relevant to people who are not yet thinking about a K, so I think all of you are ahead of this. But this is the story of my life, the 10 years up to my K, as told via grants on the top, mentorship in pink, classes and things, papers, and au pairs. I mean, children too, but you know. So I'm supposed to do this in like 60 seconds. So I graduated residency in 2009 and had my first child down there in the bottom. So and I finished residency and I did an ultrasound fellowship. We could argue about whether that was a bad idea or not, but that's what I did. And at that point I had 4 papers, 0 mentors. And then moved on to my new job at UMass Bay State, and I had kid number 2, which you can see down there, and I immediately went to 50% because that's what happens when you have kid number 2 sometimes. Ideally not, but that's the way our world works. And I still had 0 mentorship. Then I started doing some research training, and I got an au pair, so that was a big deal. And I decided I really liked research and I wanted to do more. So you see, SAEM Dallas was a huge turning point for me. I started to get mentors. I went to a consensus conference that was really important. I introduced myself to people, and all of a sudden you see those stars, my mentorship shot up. I started taking classes. Across the top, those are all failed grants unless they have red around them. So it's about a 4-to-1 ratio of failed grants to actual accepted grants. The grants start becoming more successful as I get more mentors. I found mentors at my home institution with help, so asking around, figuring out who the mentors were. Got a new au pair. SAEM San Diego, some more training, more mentors, more grants, more au pairs. And the 2 lines of publications, those numbers are first author publications and any author publications. So that's where I was, finished my master's. So that was essentially like I started another fellowship in there, which I couldn't have done without the au pairs, and I wouldn't have done without the mentors. And then applied for a KL2 and a KO8 at the same time, got both of them, and then you obviously take the KL2 is the baby K, the 2-year K, and the KO8 was the 5-year K from AHRQ. So I don't know if that was 60 seconds, but I tried. I'm happy to talk about au pairs too, but maybe afterwards.
All right. Can you hear me? Yep, there we go. Yeah, there's the story of my life. It's a simpler life. And so I guess I don't, there are different paths for folks. I guess my path was maybe a later path. I didn't do really research in medical school, even in residency. It wasn't until my third of 4 years where I started to get involved. And still, I wasn't going to do research. Like, that wasn't the plan. I didn't know what the plan was. I think I knew coming out of residency that there were things that I wanted to change. And I thought that I didn't quite have those skills. I had the clinical skills, but I didn't have the skills to really investigate or change things, which prompted when I was looking, I did residency in California, but was moving back home to Massachusetts. And so it prompted me to look for what could help me to fill those gaps. And one of the things was a research fellowship, which included 2 years of a master's in clinical and translational science. And that really, from there, kind of snowballed, like in a good way snowballed. Sometimes in a good way snowballed. But the same way, where you meet people, you have ideas, other people have ideas about what to change. For myself, it was being involved with substance use disorder and really bringing, implementing programs in our emergency departments for our at-risk patients. Meeting a mentor that, had a similar path years ago that had succeeded with that and could provide a way forward. And then kind of working and having the things that fail. For me, it was prepping my K, and then a week or two before having my mentor team being like, it's not ready, it's not good enough. And so holding until the next, which that's why they're mentors, because it turns out it was not good enough. And we were able to work on it and refine it, and we're successful with it after.
Got it on his first submission.
Yeah, but it was like the second submission, because it was late. No, it was very nice and very, it was a great mentor team to do that. So yeah, I think for folks who maybe are coming into this late, just to know that it's never too late, right? It's about what you want in your path, and your path may be a little bit different, and it may change, and I think that's okay, so.
I have to stand up to see my slides. So I'm Laura Westafer. I'm also at UMass Chan-Bay State, and I use she, her pronouns. So I also was never going to do research, but Bill talked enough about that. So I started a blog as a medical student because I noticed we didn't do evidence-based stuff.
You may have heard of it.
And I, no, not the blog. That was people don't do blogs anymore. And I went to residency at Bay State at the same time that Bill came in for his nerdy research fellowship. And I liked reading research because I could find something to support my pet peeves, but I didn't have any intent to do research. But Bill is pretty charismatic, and he convinced me that you can change clinical care through research because, podcasting really doesn't do that. And so I sort of then followed what Bill and Elizabeth did and did the research fellowship and master's. And it was at the end of my master's when Elizabeth was like, I know you're not so sure about research still, and you just did the master's to learn how to read papers, but there's this K-12 opportunity. Have you heard about it? It's a baby K. And also there's this guy, I know he's a hospital medicine person, but he's not going to refuse your admission, but he's a really great mentor, and you should do this. And I was like, but it's cardiopulmonary implementation science scholars. I don't know anything about any of that. And she's like, you do implementation science. It's called your podcast and blog. And I was like, oh, I already have a niche. I just have to tell that story to the people that fund grants. So I did a 2-year K-12, baby K, and then in 2020 submitted my first K-23, and it was rejected, and it was just above that pay line, and so I resubmitted in February 2021, and the process is super long, right? You resubmit in November, and then that was actually in 2019, I have to go by my children, November 2020, and then in February 2021, the committee met, and they were like, hey, here's your score. And I was like, oh, that's totally fundable. It's going to get funded. Awesome. Can I start? And they're like, well, you have to wait for the other committee to meet when we know it's going to get funded to say it's going to get funded. So that happened in May. And they're like, yeah, it still looks like it's going to get funded. I was like, can I start? Because I'm going to have this baby in a couple months. And they're like, no, not yet. So I got the notice of award right 2 weeks after baby number 3 was born. So it was all about the mentors and guiding me. So I work at an institution where they value Ks and trainees, and having people around you that lift you up and know, I'm not the person to be your mentor, but I know who is, was incredibly valuable because they helped me play the game. And that's what getting a K is. It's knowing how to play the game and finding the people that will help you win that game.
Like Lauren, I also have to stand up. I'm Nick Harrison from Indiana. I have a fairly similar story to others up here, Bill and Lauren. I got into residency 2016, and I had no interest in doing anything in research. And I had a few publications that mentors asked me to be on that were like not really research, but were more kind of just like topic review stuff, and started accumulating papers that I couldn't necessarily put on BioSketch for later. So that's the first lesson is don't let that red line and that blue line start to diverge from one another too much like I did. If you want to go on later for federally funded research. I changed my mind like halfway through residency and said, you know what, I'm going to do a research fellowship. And so I looked at institutions. At the time, I lived in Michigan and had no plans of leaving Michigan. Obviously, that changed. I looked at the two institutions near me that did serious, federally funded research in emergency medicine. And I talked to one of them, and they said, yeah, we'll hire you, and then, you can kind of, work towards maybe figuring out what you want to do, but you kind of got to find your own mentors, and we're not going to give you any protected time, and be how it is. And then the other one said, we're going to fund a research fellowship for you. We're going to give you 50% protected time. We'll give you a research assistant. We will give you all of the access to our biostats people and our IRB people, and we will help mentor you to get your goal of getting a K award. And I said, okay, awesome. What are you studying? Heart failure. Oh, that's what I want to study. Let's do that. So I think, quick lesson to impart there is institutional buy-in. I mean, Lauren mentioned this as well. Institutional buy-in is arguably the most important thing here. Is the secret is that, and not every chair may even know this, but if you ask your chair, they probably know this. K awards lose departments money. You cannot make any money on a K award because the math just doesn't add up. The salary support you get from the NIH cannot reach an emergency physician salary at 75%. So you need someone, who is going to say, well, yeah, but our goal is to create new and junior investigators, create independent investigators out of them. So I got the first grant I ever submitted, which was incredible, and then I didn't get the next 7. And then I went for my first faculty position at IU, joined 2021 after I finished my master's and my fellowship, and had another baby at the same time. After that baby, I've only missed 1 grant, so I don't know if there's correlation there. I got the KL2 award, and I was actually, so I'm on a baby K. I think I'm probably the only one here who's on a baby K right now. I was going to apply for a K23 this cycle in June until, roughly a month and a half ago, after tortured conversations with mentors asking what I should do next, and more of them saying, you're probably not as not ready for applying for an R as you think you are. And I still don't know if I believe them on that, but that's what I'm doing in October. So.
I'll try to keep this brief because I think the subsequent slides will be really fruitful as well. Ambrose Wong, I'm a health services researcher at Yale on mental health. So I think mirror a lot of experiences that you all had on the panel. I absolutely detested research in medical school. I did a lot of bench science, and I was like, this is horrible. I don't want to be benching. I mean, I went to WashU, so at the time I didn't realize that you can do research that's not on the bench, because I feel like that's all you get exposed to in medical school. And so I was very passionate about simulation, healthcare, quality, and safety. And so I actually did a fellowship in medical simulation where I did my residency at NYU along with Michelle. And so after coming out of simulation, I started getting really interested in quality and safety and realized to do it well, you really do need some foundational training and scholarship and research to do it well, and also medical education. So I started doing one master and after another. It's like, I'm sure, like you all. I first did a MedEd and got a couple of education grants. And then I started getting sort of grants that were a little bit bigger, 10 grand and then 25 grand, and started getting some publications. And then all of a sudden they're like, oh, now you do research, you should do a K. I'm like, what the fuck? I, like a lot of you all, I did the baby K, which does feel like a little bit of a lower threshold into the K world. And so the institutional K, which is the CTSA KL2, was a nice 2-year gap. And then I went for the full K23 sort of in my first year and had to resubmit. The first time I lost my primary mentor and my secondary mentor, both left Yale in between my submissions, and was like, oh shit. But they didn't seem to, we have all our ways to massage the grants and it worked out. So I'm currently on my second year of my 4-year K23.
Hi, everyone. My name is Julian Hertz. I'm at Duke. I'll be brief. Sorry about the horrible formatting. I'm not good at slide design. So like everyone else, I was not that interested in research, and I graduated residency in 2016 and actually just took a full-time regular clinical position at Duke. And I kind of came to a K sort of diagonally, because what I was really interested in is global health. I have a lot of experience working in Tanzania, and I had really specific interest in why the heck no one was being diagnosed with myocardial infarction in Tanzania, where I work, and whether something really interesting was going on epidemiologically, or whether we were just not diagnosing people with MIs because we weren't testing them for MIs. And so there I was, like a full-time clinical faculty with this interest that almost no one would fund. And so although I had a fair number of publications, none of them were related to myocardial infarction in Tanzania. So I realized that if I want to, pretty much the only person who will fund that is certain NIH centers, and many of them won't fund that kind of work. So I had to find a way to get preliminary data and publications in this realm to make the case that this is something worth looking into. And so I did a global health fellowship, and that gave me a year basically to move back to Tanzania, live there full time, and get my preliminary data. And so I submitted my K23 right at the beginning of COVID, and so had a full year between when I submitted and when I got the NOA, which meant I had a full year to forget like everything that I'd written down. But the things that I've learned, I probably put my key lessons here. No one really told me about the career development section and how it's like literally half of the K. And so I was kind of late to recognizing how important that part was, and I wish that I had learned that. I mentioned preliminary data. The budget is really small, and so I had to write a grant that reflected the small research budget. I think like everyone else here, probably the thing that helped me the most was just looking at other people's successful Ks. I didn't have any mentors who were doing this work. I wasn't working within someone's ongoing MI research program in East Africa, and so I didn't have like the same topic, but I found you look at like 10 Ks, you start to see the pattern, and you can just plug in your name with your research interests. That's all. Thank you very much.
Hi, I'm Christian Pulcini from the University of Vermont. I'm a pediatric emergency medicine attending. And there's a whole lot of pictures here that I will guide you through. With the risk of being awkward with everyone else, this was actually my plan the whole time. And I'm being serious, but I did take a break. I was in Teach for America and was a teacher for a few years, and then I did an MPH before medical school, and so I went into medical school with an interest in research. So back in 2011, I was a second-year med student. I did a research fellowship with those folks who are directly under, and I'm here to highlight the mentorship piece of this. And I met these folks. The two on the top are actually both in the National Academy of Medicine when I was in Boston, and they have been amazing for the past 10 to 12 years in terms of sponsoring me and promoting me, and they both wrote letters of support for the K. So once you get really good mentors, no matter how long it is, hold on to them, because it was extraordinarily valuable having them write letters of support for my K when I went to apply. And then you see the person on the bottom there, and then you see her back over here. And I just want to tell that story a little bit because it's interesting. When I was doing the research fellowship as a second-year med student with the gentleman who's above her over here, she was a research fellow, and we collaborated on a paper together because we just happened to be sitting in the same space. I saw back in probably 2020 her post something on Twitter about how she's becoming an implementation scientist and she has a K. And I was like, oh, Sarah Beth, that sounds really interesting. Tell me about it. She's now on my primary mentorship team. That many years later. And it just goes to show you when you develop these relationships over time. And she's now transitioned to the R phase, and she's actually at UMass. She's at a different institution than me. And I will say that when I moved to UVM, which is a smaller research university, I am pediatric emergency medicine, and what I'm doing is kids with medical complexity. My primary mentor in my institution, because I had to go searching around for somebody, like, to be honest with you, that was R-funded. And that's Renee Stapleton in the bottom right. She is a adult pulmonary and critical care doc. And she runs trials, like multiple trials, on stuff obviously not related to kids with medical complexity. And so my mentorship team, I had to piece together a few different people with Sarah Beth, implementation science, Renee doing the clinical trials piece because I'm doing an implementation trial, and then another pediatric emergency medicine colleague who had some K way back in the day but went off the research path but had content expertise. And that's my primary mentorship team. And then I have a group of people that I meet with every 4 to 5 months at different institutions who sort of filled all of those gaps. And I'm happy to share with anybody, especially, I have like a diagram of these people that went into my K, but it did take some piecing together at a small research university. So that's one thing that I wanted to highlight here. And then, of course, my 3 kids, I just point that out because this is the first slide I've been able to put them on the whole conference. That's it.
Yeah, I can also go quick. I am with the first crowd, never ever pictured myself doing research. And I actually published my first publication as faculty, so I had severe imposter syndrome, like, for a very long time. I also I'm not interested in disease systems, and that's how the NIH is organized. I care about populations and health systems and how we can create evidence that supports the emergency care as a part of the safety net and the vulnerable populations that we care for. And it took me about 5 years to figure out how I was going to thread the needle between a project that I cared about and a project that the NIH was interested in caring about, interested in funding. So my K-23, I'm at the end of my 4th year and working on some pilot grants for an R1 because I'm, COVID, I moved. And it's funded by the NHLBI, who is very friendly to emergency care research. I do asthma research because, it's a disease that disproportionately affects black and brown people with terrible access to care, poor air quality, and it allows me to study things that I care about. Do the K, make your chair invest in it. It's an important contribution for our specialty, and it's like an incredible time for your career to be cultivated.
Great.
Questions so far?
Yeah. We hope it's helpful. We start with this because I think it's important that you can see a wide range of people and start to maybe, relate to some of us. Some of our journeys hopefully are the same as yours. And definitely even after this session, if you have someone you're like, that's kind of my journey, then come up and talk to us individually. Yeah.
Some of you did institutional Ks and then did an NIHK. Can you talk a little bit about doing them sequentially? I know you can't simultaneously.
It's a sweet deal. So I'm gonna y'all saw in the plenary that the average age of attrition for women in emergency medicine. So I identify as a woman, not plural, and I'm 38 currently for a short while longer. So I got 2 years of an institutional K at 75% protected time. Then NHLBI allows you 5 years on a K-23. So choose something, PE, cardiopulmonary blood, and go to NHLBI because they give you 5 years. So it's really great. It allowed me more time, so then I will retire and not have the pressure of an R. But in all seriousness, a KOA, it's a lot more work. So my application for a K-12 was very short. I put it together in a month and a half. My K-23 felt I was growing a human simultaneously. And I am not, probably because he was my third kid, but like I think it was harder to write the K because it just like, it's figuring out all the pieces. So like that took longer. So it depends on your timeline, but you can do them sequentially. And institution depends on how many years you get.
Yeah, and it's very, KL2s are very institution dependent, like your institution has to offer it. And in many cases, they're easier to get than an individual K, but in some cases they're not, because it depends on how many people are competing for that. And in some places, it's actually very political, like, you know, the chairs take turns and like, you know, X department has, you know, one awardee 1 year and so on. So you really got to know where you are.
Yeah, I think that's a great point because it's, I think I heard before I got to my current institution that the KL2 success rate was like 50% or something like that. I was like, oh, great. And then the first year I applied, it was like 8%, which is worse than like an NHLBI or a 1. Now, granted, it's all internal applicants, so there's a big difference. The bottom line, though, is like, even though, as I said, this is not what I'm doing, see if that's the right decision or not, but you will never get more protected time. Never get more protected time than when you're on a K. So if you can do a sequential KL2, K12, and then, you know, another 5 years on a K08 or K23, that's tremendous. Because, I mean, just poll. What do you think typical buy down time for an R01 is? Yeah, somewhere around there, around 20. 20-ish. Could plus or minus 10% in either direction, depending on the project and, you know, how you sell it. But
So that's actually, it's a fun controversy that I think is worth talking about. Like, you've done your KL2, should you move on to an R? Should you try to go for a bigger K? But we'll get through the slides, and if we have time, I think we should talk about that. So I think you guys know most of this. So the salary, you're expected to work 75% of your time on research and your career development, which means often classes or some sort of training. You do not get a lot of money for research staff. So the Ks provide 75K to 100K for you, which you will recognize is not 75% of your salary. And the research funds for your staff are between 25 and 50. And this is different for AHRQ versus NIH, and maybe different for different Ks, and probably will improve a tiny bit, you know, each year. So this, worse for me because I'm in the fifth year of my K, but if you get your K next year, it might be a little bit better than this. So the next one. So pre-planning. So I think we touched on a lot of this. Institutional resources are going to be really important, and mentorship is going to be really important. Most people who apply for a K have some degree of protected time before they apply for the K, because that's what you need to write a K, and that's what you need to get yourself ready to be the person who's writing a K. And so either they're writing it because they're coming out of KL2, or they're writing it because they're coming out of a research fellowship, or some other time where they started with a little bit of protected time. My institution at that time offered a grant development grant, where they gave you a grant for some protected time so that you could then write a grant with your protected time and get a grant. And the nice thing about that is that your institution recognizes that getting a grant is not something that you can do without protected time. So you have to put some investment in, like we were just talking about. Does anyone want to go back for 1 second about primary versus secondary mentors? Anyone want to talk about specifically the mentorship questions?
Unless we've already talked about it, I think the primary mentor is key. Like, it should ideally be someone who has had multiple R01s, who has already successfully been a primary mentor for other K awardees who've gone on to get their own R01s. And if you think about that, like, the number of emergency physicians who have attained that level of, you know, sustained funding is like, I don't know, like 5, probably more, but not that much more. And it's like the odds that you're going to be at an institution with someone like that are also probably not high. So a lot of people have non-EM mentors, and yeah, exactly. I happen to have had an EM mentor, Lynn Richardson, who's amazing, but your primary mentor should probably be at your institution, but doesn't have to be an EM person.
yeah, and I mean, exactly what Michelle just said, and the only thing I would add to it is, part of it also is like that the funding is active and not like about to expire, you know, when your case starts. I mean, these are little grantsmanship things, but these are the kind of things that they will ding you for, and you don't want to leave anything on the table for the study section to look at and say, yeah, we're going to disqualify you. So for me, my primary mentor, had R1 funding and through AHRQ, and then R21 funding, or R35 funding rather, through NHLBI, but they were both expiring around the start of when I was applying. And so instead my primary mentor is not him, who's my chair in EM and studies the same thing that I study. It's a cardiologist who studies something that is pretty similar to what I study and has been an incredible mentor, and frankly, like having a diversity of specialty and opinion has helped a lot, but the initial marriage of it was a marriage of convenience and grantsmanship.
So we've kind of covered how to build a mentorship team, who is going to be that primary mentor, and also to think about the fact that in emergency medicine, there's a real lack potentially of primary mentors, and thinking about, I think for most of us, expanding out into other areas and interests. Two of the other challenges that we came up with, obviously the research interests, if they don't align, there is not an NIH subsection that's just emergency medicine, right? So we align with different areas around that. And also how to identify an institute, and interact with program officers. And I don't know if there are specific questions, or we can kind of ask our panel if you have any advice, either if your interest didn't quite align at first, or any interactions with program officers that you might want to say.
So I had great advice before my K. So my K is in shared decision making. So it does not align with NHLBI or NIDA or anything. And at first it was like, is anyone really going to fund something in shared decision making? And I love talking about it because it's like, I'm funded in something that you didn't think that I could get funded in, which is very cool. But one of my informal mentors, and we didn't really talk about how you have formal mentors and you have informal mentors. You have the people who really look good on paper and they may be awesome and they may not be awesome. And then you have the people who you can go to with all your stupid questions and you don't feel like a jerk. So one of my informal mentors basically said to me, listen, there's the stuff that you get funded for, and then there's the stuff you really want to do. And if they happen to overlap, that's awesome, but they're not always going to overlap. She took 4 K submissions to get her K in 2 different areas. And that was awesome for me to know that it took her that long to get her K, because then I was just like, it's just perseverance. And during her K award, which was on like CHF or sepsis or something else, she did an unfunded study on access for people with disabilities to OBGYN's office that made NPR and led to an R01. So her unfunded thing that she was passionate about, she just did it in her K, and it led to something else. And that is, I think, a pattern that I see. You do need to find something that can be funded, but it doesn't mean you need to abandon the other stuff that you can't figure out how to get funded. So AHRQ does fund shared decision-making research, so I was able to find a home, and then within that K, I can sort of do other things.
I just want to say, I remember hearing talks like this and feeling kind of insecure because, like, I didn't really have obvious mentors. Definitely no one who was doing what I was doing. Definitely no one who was invested in me. So if you're feeling that way, it's totally fine. I cobbled together a mentorship team of people who were not emergency medicine but looked great on paper and were willing to pretend to care about me for the application. So just know there's lots of ways you can build a successful mentorship team. At the end of the day, I think most people in Ks feel like you ultimately become your own mentor and have to like blaze your own trail, ask for the help you need, learn what you need to learn, ask for help from your mentors, and you get a lot of unresponded to emails, so it's okay if you don't feel like you have this perfect mentorship team out there for you. With regard to program officers, I also got really annoyed because I felt like I was always talking to people who are like, oh my gosh, I'm best friends with my program officer. We email all the time, we meet for coffee, she loves my research. Like, I sent so many unresponded to emails to NIH people. No one ever responded to me. I never had any contact with anyone from the NIH despite my best efforts. My only contact was them sending me my NOA after I submitted. So it's totally fine to, if they don't respond to you, I don't know, maybe like NHLBI, I don't know how. They did not respond to my emails, and I felt very insecure about that, but that does not mean you're not going to get funded. At the end of the day, it's the study section who's evaluating your grant, and it's not your BFF program officer who gets to decide who gets funded.
I'm funded through NICHD, and it turns out that the NIH can't get emails from one of my email accounts that I was sending. No joke. So I thought for 6 months I was just getting ghosted by the program officer, and I'm like, I'm sending her an Ames page. Why doesn't she care? Like, obviously, they don't have fun. But the mentorship piece, one thing I did want to say is I mentioned that my primary mentor is pulmonary critical care. That, I think, sharpened my application, because she's like, why are you studying this, and what does this mean? And so when you actually get somebody outside, that's almost like simulating a review panel at the NIH. Because if you just have all emergency medicine people, like they get it for the most part. But I think actually having this broad mentorship team across disciplines has made my research and made my applications and grantsmanship actually stronger. So I wouldn't shy away from getting somebody in a different discipline, because it actually, for me, it helped me practice my elevator speech about my research too, because I had to give it to my own mentor.
And it brings up, we started to talk about kind of the next aspect as you are writing and preparing, thinking about what you're writing, and then eventually how is it actually scored and what's happened. So I'll submit back to the group here your strategies on actually writing this. Specifically, we have, do you need preliminary data? What about, the project? What's the scope of the project? Your career development? Do you just fill it in? And we kind of already talked about the mentor. So I wonder if others on the panel have some comments.
Ask people for their Ks that got funded and read them, and then ask more people for their funded Ks and read them, and you'll see these patterns of what successful Ks look like. Because you can, I Googled, and I tweeted a thread, that's what I was doing on my phone, was tweeting a thread about these talks, and I just went to websites and looked, and then asked Elizabeth, can you show me your the funded one, please? Exactly. So we created these things, like a Google Drive that had those, so our fellows and people have access to those, to the grants that we submitted, so read them. I know it's almost time, so we should probably break for questions before too long.
I do want to say, we actually have, Michelle created a Google Drive of funded Ks, so we should make sure that we write everyone's email address, or you email us, and we will give you the Google Drive of funded emergency medicine Ks. Perfect. Yeah. Do we want to do questions? Do we want to just break for questions? So here's us. Feels free to email all of us. So I will say, we talked a lot about mentorship. You have the mentors you have on paper, which we sort of alluded to, and then you have your peer mentors, which is essentially like everyone in the room right now, right? You can ask study design questions to everybody, and you can bounce things off of everyone. So there's just tons of mentors, and if you have the people on paper who look good but don't care about you, you should know that there are the rest of us who actually really do care about you and really, really, really want you to be successful. So you just got to find those people, and they do not have to be at your institution. They could be any of us. But there are definitely people out there who care about your success and really want you to succeed. You just got to find them. But we are here. Questions? And I think we have to use the mic because we're being recorded. Make you go ahead.
And I think any of us to volunteer everyone are happy to read your one-page specific aims. So please reach out.
Hi, my name's Carlo. I'm from Montefiore in the Bronx. Thank you guys so much for this. It was really helpful. I finished my research fellowship last year, and I've been trying to put together. I applied for an R18 through AHRQ, got shot down. I'm kind of reinterpreting it as a K. And I think what I'm having the most trouble with is the career development section. The feedback I've gotten is I built the mentorship team well. It's clear what each person's doing. Everyone tells me you could put some classes into it or something. The place I'm at doesn't have the courses that I want. The places that do, I can't afford. Or I can't get, I can't pay for credit. I already have a master's. I don't want it. I can't get a second. I guess I could get a second master's. So I was like, oh, maybe I could take courses on Coursera. But then people are like, well, no, that'll make it look like your institution doesn't have a way to support you.
That was in my K. Those courses were part of my funded K-23. So I have 2 masters. My wife said I could not get a PhD, and I value her immensely. And so And so, thinking about the career development, I had to tell a story as to, especially my second K, after a research fellowship with 2 masters, why I needed more training. And so I was like, well, I need more training in implementation science, and I need more training here. And specifically, and I put courses. I didn't need, there were a couple of classes like at UMass, Worcester, but like it was, I'm going to this conference, or then it was like virtual, but I put that stuff in there and I justified it because it fit the niche that I was telling them I needed to do. And I knew I needed to make that case as to why they should give me that training because I was going to be so successful and nobody else was doing that stuff. So you can make the case and you can put that stuff, you just need to justify why.
You don't actually have to do what you say you're going to do. You just have to tell them something that's good enough for them to fund you. And the career development plan is important. It's weighed equally to your project. So we all sort of pour our blood, sweat, and tears into the project, and they're like, oh, I didn't think about that. But you have to tell the story of like what you need to do to get your R1 and what's going to get you there. I have the same situation. I wrote in a bunch of seminars. So like, you want to do implementation science. There's like a 1-week thing at UCSF that's like, like in person and hybrid and stuff like that, right? I think there's like all these short courses I think that we all know about. So just email us what it is that you want to do, and I'm sure we can find a short course that's like a couple days or something that works.
There's also a script to the career development plan. So, sorry. I don't know how many of you guys have done the sections of like personal statement, and then there's like career trajectory, and then you do your mentors, and then you do the classes, and then you have a table at the end. Like all the career development plans, stuff like that. So it's almost like the reviewers are looking for that. They want to see those sections because they're just used to seeing that in the K. And so you just BS a bunch of crap. I mean, really, like Michelle said, there is a lot of stuff there that I ended up not finding really useful, or you learn as you're going through the research plan, as you're going through your actual K, that it's not actually going to be and you just learn from that. But you're storytelling a little bit, so you just want to make sure that it's all cohesive and tight.
And they will nitpick everything. Like they may nitpick your courses, but my K-23 initial submission, one of the biggest pieces of feedback was, well, she's a DO, and she got her training at UMass at Bay State and is at Bay State, which is a moderate research institution. Fair, but like that was the feedback. And so they will nitpick little things. And at first I saw that and I was like, those, but like there are things you can change, things you can't change, but you just have to make it convincing in other ways.
And you could add things that are like bi-weekly 1-hour meetings with your primary mentor, every 4 weeks like with your secondary mentors, and like SAEM meetings like as part of your networking, for research, collaborators, like all of that is part of your career development plan.
Go ahead, and just if there are other questions, I'll pass the mic to you all.
Just to put in a plug, once you get a grant scored by the NIH, you can sign up to be an early career reviewer on their website. I just did that, and they actually got selected and went down there. And I will tell you, the nitpicking, I was amazed by it. They actually reviewed a K that I was not involved in that probably did not receive a fundable score, and it was extraordinarily similar to mine. And I'm sitting there thinking, I think it was just the people in the room. So speaking of resiliency, there's part of that as well. And as long as you're mentors and you know that the science that you're doing is going to, advance human health and it's worth keep applying. The courses, they might tear those apart and then you're going to have to redo it, whatever. I did free courses through the NIH. Like the NIH has free for clinical trials. So I threw those in there. I'll do those eventually. I even threw in like an economic course at like the University of London. Now I don't know how I'm going to pay for it, so God knows if I'm actually going to do it. But we'll see.
Yeah, and they told me I was doing too much. So my first submission, I wanted to do clinical trials and I wanted to do implementation science, and they were like, oh, it's too much, and I had to cut out some of the coursework that I was going to do. So I think that you find a bunch of stuff that looks good with the story, and then and you just tell that story, and then you do what makes sense for you to do. Other questions?
Hi, my name is Ajay. I'm a research fellow at UCSF. I'm going to be at Emory this fall. I have a question about identifying mentors outside of emergency medicine. And I've heard some stories sometimes that when the funding does come in, maybe it's split between different departments, and like how you kind of navigate that politically, or did I get bad information?
Yeah, so it's a great question. So this is an important part of it. Your mentor doesn't get paid to be your mentor, anything. So that's why they have to, so either they're going to be a good mentor on paper and they're not going to be helpful because they're not getting any funding, or they're actually really committed to you. And that's one of the reasons why when your mentor writes their paper, their very important letter of being your mentor, they talk about how their other mentees have been successful, and they talk about how they have independent funding and they don't need funding to be your mentor. There is the challenge if you are in 2 different departments. So Lauren, Bill, and I are all faculty in the Department of Emergency Medicine and in the Department for Healthcare Delivery and Population Science, which are 2 different departments. And when you have a salary where 75% of your salary is supposed to be paid by this and it's not, you have a cap gap, which is the money that needs to get paid by some institution. You do need to figure out which of your 2 departments is paying that gap. And so that can be challenging and something that you would like to talk about before you get your K, but can be very hard to talk about.
But also, your mentors don't write their letters, right? So when you write all of these wildly enthusiastic letters about yourself.
I think she needs to say that into the mic for posterity.
Just a reminder, so you write all of your mentors' letters, and so you have to be really good at positive self-talk and like how wonderful you are, which is the most awkward thing ever. But you also do all of that work, and it's, you have to make the case in their letters.
ChatGPT. And like changing institutions for a K, totally happens, right? Normal to change from fellowship to like, where you're gonna write your K, but you don't have a track record yet. So start like thinking about who you want on your team, stick them on your abstract, and start to build that track record so that by the time you're ready to submit, because it's gonna take at least probably 2 years for it to get funded, you have a bunch of abstracts and ideally papers.
I think we have time for one more question. Go ahead, Ambrose, take, and then if someone has a question, I'll pass the mic to you.
I was curious to the panel, how many of you all have your primary mentor in your department and then in your institution? I'm curious.
In the department? No.
Zero.
So, yeah, I mean, the best thing that happened to me is when I got hired at my current institution, which is not where I did my research fellowship, is a senior researcher who was going to where I did my research fellowship, who was swapping places with me in the most lopsided trade of all time, said, oh yeah, you're gonna start in 6 months. Let me introduce you to all of these people, to this cardiologist, to a pulmonologist, to a sleep medicine person, all of these different people before I started. So again, that's having an institution where you have advocates for you, even if it's not in emergency medicine, your chair or the other senior researchers in emergency medicine should be your advocates for that, or other people.
I'll ask the final question. What about the 75% protected time? Did you have to negotiate that? What does that look like in your institutions? Is it truly 75%?
So I've done a lot of informal surveys. The range probably is 350 hours a year, which comes out to exactly 4 shifts a month, to 800 hours, which is the high end. You should be getting the same salary as any other assistant professor in your department, right? And if your chair tells you that they don't have the money, then they can't support you. They tell them to ask the dean. Research has to get subsidized with clinical dollars, otherwise, it's tough. But have that conversation and know what it's going to be beforehand.
Yeah, it's going to lose money. They have to understand that, and they have to be on board with that. They didn't write in.
It's an investment in you.
And it's probably going to take 3 to 5 years after the K to get your R. And you don't have to have that in writing, but just, your chair should know that.
Perfect. Well, thank you, everybody. Thank you to the panel. Thank you to all of you for listening and asking questions. And yeah, thank you very much. I think some of us will be around. If you have specific questions, please, the QR code, download our Ks, look at them, use them, maybe change some of the names.